Hi, this is Jessica DeMassa, and I'm here with Charlie Ornstein. He's the senior editor for Propublica. So tell me a little bit about that and what you guys do.
So Propublica is a nonprofit news organization. We are devoted to investigative reporting and accountability journalism. And for the past 9 years there, I've covered healthcare and done a whole lot with health data, and now I'm an editor.
Okay, fantastic. So you're here at Health Datapalooza, and I want to hear. So what kind of big trends have you been seeing lately? Like, what's going on from your vantage point?
So we're really focused on getting health data released. So health data released from Medicare, from Medicaid, from health exchanges, health insurers, states. We feel like consumers are going to be more empowered if they have access to data, not just on the system generally and what's going on in their region or their county, but what's going on with their doctor. We really feel like people want to know more information about the people that provide care to them, and right now it's really hard. We're hoping that with the release of additional data that's at the provider level, that people can make better healthcare decisions for themselves and their families.
How's that going, getting that health data wrestled out of there?
So there's a lot of information that's coming out right now, which is really exciting. So one is that for the first time, beginning a couple years ago, you could find out whether or not your doctor got payments from the pharmaceutical industry or device makers.
Right.
So the open payment system, which is on the federal government website, we have a tool called Dollars for Docs. You can look up to see, did your doctor get money related to a drug that they're prescribing you, which is really important because it should trigger you to ask some additional questions.
Sure.
So you go in, you type in your doctor's name, you find out which companies pay them and which products that it's related to. So I personally would want to know that if I'm being prescribed an expensive drug, I'd ask my doctor a couple more questions based on that. Other data that's, I think, really important is the drugs that doctors prescribe. So when you go to the doctor, you assume the doctor is prescribing what's right for you, but you really have no way of knowing, is this doctor prescribing like his or her peers? You have no clue, right? It's totally based on trust. But so the ability to look up and say, actually, this doctor is like prescribing things really differently. He's prescribing way more opioids. He's prescribing way more antibiotics. He's prescribing way more expensive drugs. I should be asking additional questions or perhaps thinking about changing doctors. And finally, what are the services that doctors are providing to patients? So some doctors order way more lab tests. They order way more CAT scans. And again, it's all based on trust. Like until very recently, you had no way of checking this. So now, like the notion that you can go online and look up your doctor and see, does your doctor look like his or her peers, is really powerful and exciting.
How do you think that's going to help, I guess, advance this consumerization of healthcare that we've been seeing over the last couple of years?
Well, I think we expect consumers to take more control of their healthcare, and yet we are giving them very little to do that. Like you have to work for it, and it shouldn't be something that you work for, right? I mean, I envision a day when, whether it's you go to Yelp or you go to your doctor and the state medical board or wherever, all of this information is going to be integrated and it's going to be presented in a way to help you make decisions better. And right now, like, how do people pick their doctors? They ask their friends and family members.
Or they go where their plan makes them go.
Or they go where their plan makes them go, probably more so that. But people can be sort of steered in a very wrong way, and we have to give people better information and make better decisions.
What data do you feel is missing that you just wish, like, more than anything, it's like, if we only had this data, it's like the missing piece of the puzzle?
Well, right now, I think we're so reliant on government data, and so we're missing the entire commercial private sector.
Which
and
is
I think
huge,
that right, I think insurance companies need to step up, and whether it's together or separately, start releasing this data and sort of stop taking this view that, like, we're going to take this proprietary packaging. Because what we found is that when each individual insurer sort of is only willing to look at their own data, from a doctor's perspective, one insurer says they're great, another insurer says they're terrible, and there's no way of knowing which is true, and we got to move past that. So I think insurance companies need to step up and be part of this data revolution and release data and not just rely on the government to do that.
Is there anything that we can do, I guess, in the broader health industry or like even as healthcare consumers to help kind of egg them on in terms of releasing that data?
Well, tell them we want it, right? We want to know, how does our doctor practice medicine compared to other doctors? That that should not be this question that you have to fight hard for, right? Right now, we're talking so much about price transparency, about getting the prices of healthcare up. But like, to me, I care way more at the moment about, like, is my doctor actually
a good doctor.
A good doctor doing the right thing, right? Like, if you're being told you need something and you actually don't need it, and the doctor you're going to is a doctor who's doing something that is not like other doctors, I want to know that.
All right, so last question for you. We're asking everybody for their WTF Health. What's the future? What does the future hold for this? I mean, what do you see, I guess, in the next couple of years? Do you think we're going to get some of that data released? Like, what are you anticipating, especially now that we're seeing some of these big tech companies like Apple and Amazon come, charging a little bit more strongly into the healthcare scene. We're seeing the Berkshire Hathaway, JP Morgan, Amazon merger where they're just like, screw it, we're going to do our own thing. What do you think? What's the future?
So I'm somewhat optimistic, but I say somewhat because over the past 5 years, we've seen a lot of additional data released. But, there's some questions about the current administration and its commitment to releasing health data. There are other parts of data that have gone offline, whether it's White House visitor logs, there's discussion of taking the consumer finance complaint database offline. And to the extent that we start removing health data and not adding to it, that's going to make me pessimistic. But I have to think that there's a lot of momentum built and that we're just going to have to keep pushing to build on that momentum.
Fantastic. If people want to find out more about you or learn more about Propublica, where do they go?
Propublica.org.
Fantastic. Well, thank you so much for joining us. It was a pleasure to talk to you here at Health Datapalooza. I'm Jessica DeMassa.